There are growing questions about how and why some people are ending up dead after police are being called in for wellness checks. You'll remember the name Chantel Moore, an Indigenous woman who was shot and killed by police in Edmundston, New Brunswick this June. They had been called to perform a wellness check on her. Similarly, 62-year-old Ijaz Ahmed Chowdhury was fatally shot by police in Mississauga, Ontario the same month. He suffered from schizophrenia, and his family had originally called a non-emergency health line over concerns that he was not taking his medication. And then the case of Regis Korchinski-Paquet, an Indigenous black woman who fell to her death from her apartment in Toronto in May. It happened after police had entered the unit in response to calls from her family. All those deaths sparking protests over the summer. Well, as a result, the City of Toronto has begun consultations on what might be next steps, and our next guests are hoping to provide the city with a civilian-led mental health crisis team. Asante Houghton and Rachel Bromberg join us right now from Reach Out Response Network. They've begun town halls with communities over the summer and are planning new ones with the city in October. Asante and Rachel are both in Toronto. Hello to the two of you.
How you doing?
Thanks for having us.
Listen, Asante, I'll begin with you. What is the goal here with the Reach Out Response Network?
I think the main goal is, the first thing you alluded to was the harm that was caused to individuals during wellness checks. So I think for us, the main goal is to reduce the probability of that harm. And on top of that, folks who are in crisis, to give them more positive outcomes and to really help them get the support that they need.
Okay, Rachel, I'm going to ask you to build on that, because the question, of course, many people are asking is how different would a civilian-led mental crisis team be from what is already in place with police services across this country?
Yeah, so what we're really trying to do is just make sure that the best person for the job is responding to the situation. So someone who's in a mental health crisis needs a mental health expert who understands what they're going through and can de-escalate the situation to respond to them, and as well as to connect them with additional resources. So that's really what we're trying to build.
Now, of course, part of this is the call to defund police. And Asante, I'm wondering whether or not people actually understand that message. I know that it's been resonating through the summer, but people still hear the word defund police, and they equate that with safety being compromised. Talk to us about how safety is addressed with this type of model.
Well, with this kind of model, the first thing that we're doing is like Rachel was alluding to, is we're really putting the experts on the scene. And so some folks might hear civilian-led and feel like we're just expecting, the average Joe to show up. But really what's happening is a mobile crisis team that is not police-led will be showing up to the crisis. And that team will comprise of individuals like peer support workers and other mental health workers as well. So really having people who are most geared to be helpful in the situation, at the situation.
And I guess part of the hope here too, Asante, is that when people talk about situations, they're always looking to de-escalate a situation. With mental health professionals, perhaps it wouldn't be escalated in the first place?
Yeah, and the tough thing about it is we, I think, as a society have particular perceptions of what police are for, and we associate police with threat and danger and bad things are happening. So when officer arrives on the scene, that is a huge part of it. Then you look at, the potential for bias and things of that nature to come in for the officer, and it potentially creates a powder keg with a situation that really doesn't necessarily need to escalate if the folks who are maybe less threatening for civilians they're the individuals who are showing up and being able to provide service.
So really you're saying on both sides, not only police, but also for people that see someone at their door, perhaps not jumping to conclusions when they see a uniform.
Well, yeah, I think part of it is that when we see a uniform, it means something for us, right? And, also a police officer, they're expected to do so many things within our society, and they're seeing different things every day. So it would make the most sense, it seems like, to have, once again, the individual who knows how to de-escalate a mental health situation, who knows how to recognize what's happening, who knows how to see signs and symptoms, and has experience, a lot of experience interacting with folks with presenting in different ways. So that's really what we're hoping for, is, having people who are specialized showing up to the crisis and being able to be helpful, connect folks to services and things that they need, and maybe even do a little follow-up as well.
Now, Rachel, we are now seeing the City of Toronto getting interested in the type of program that you are advocating here. Obviously, Toronto, the biggest city in this country, but I'm wondering about this type of approach in smaller communities, perhaps even rural ones. Is there an application for this that would be helpful, do you think, in smaller centres?
Absolutely. So Asante and I have done a lot of research on international models of mobile crisis services all around the world. And we've seen that this kind of model can be very successful in a large city like Toronto, but it can also be very successful in smaller cities and smaller towns. So Cahoots, which is a mobile crisis team in Eugene, Oregon, that's the main model that we're basing our proposal on. And Eugene is a city of about 170,000 people. Olympia, Washington also has a similar team called the Crisis Response Unit that launched 2 years ago. Olympia is a city of about 50,000 people. But there are also very large cities like Denver, Colorado, that have recently launched similar teams, and many large cities and small towns that are looking at this kind of model and are building an implementation plan for it. So New York City, Portland, Oakland, Houston, Chattanooga, Tennessee, lots of different places are looking at these models and trying to figure out how can we take something that's already working and adapt it to our local conditions. So that's going to look different for a big city like Toronto than it would for a smaller town, but there absolutely is a way to do it.
Okay, so here you are now. You've already engaged in 10 town halls talking about this as a possibility, speaking to interested parties. I'm going to ask both of you to share your perceptions of the type of response that you're getting, the type of feedback you're getting, not only from people in these town halls, but also from city officials in Toronto. Asante, I'll begin with you.
Yeah, I think what's interesting is we're hearing so much support for what we are thinking about or wanting to do. So really a lot of folks are really on board, whether that be service users or service providers. Realistically, this is what we're advocating for, and what we're trying to do is something that has been advocated for many years and decades, generations. The political window has opened a little bit this year with the various things happening, down south in the States, but also here in Canada, which has really put to the forefront that this is an issue that probably should have been focused on before. And now we're finding that the community is really, kind of pushing for this to happen. So within our town halls, we're finding a lot of support.
And Rachel, what have been your perceptions of these town halls and the type of feedback that you're getting?
Yeah, I think similarly, people are very excited to see an alternative to police response for a lot of mental health crises. I think there are some main themes that we're hearing a lot of, one of which is that we're hearing very consistently how important it is to integrate people with lived experience, peer workers, onto the front lines providing care for folks in crisis. We're also hearing really consistently the importance of integration into the 911 dispatch system, because that is the system that people know to call, that is accessible to people. If you're at a payphone and you don't have money, or your phone is out of minutes, you're not able to call any other number, but you are able to call 911. So that's something we're hearing very consistently. We're also hearing very consistently the importance of referral pathways. So it's one thing to create a really good crisis service, but it's also really important that we have somewhere to refer people to, somewhere to send them after that crisis is over. And we're hearing a lot about how those additional services need to be funded and need to be supported. And we're hearing about just the importance of having enough time to actually be able to spend with someone to de-escalate them. A crisis isn't over in like 10 or 15 minutes often. Sometimes it is, often it isn't. So we're really just hearing about the importance of a client-centered approach that can really be present with someone who is in crisis, give them the time and space and the support that they need to feel calmer and safer, and to get them the actual help they need with the referral, with connecting them to other services. Okay,
so I open this up to either one of you then. How close are we to seeing something like this come into fruition?
I think we're closer than we think. I think, what we're involved in right now is really taking the first step toward making something like this happen in Toronto. The impression that we get is that there really is a commitment from the city to make this happen. Of course, we would all like for these changes, any change really in society, to happen really quickly, but we also have to understand that these things take time. There are a lot of things to think about. The city is really big, so it'll probably take some time, but I'm quite confident that it'll happen.
Rachel, quick word to you if you like.
Yeah, I think that, the biggest barrier that we've seen is really just stigma. It's really just that people don't actually understand what mental health crisis is and what it looks like, and that it isn't actually scary, violent, and dangerous. And Asante and I have done a ton of research looking at civilian-led mobile crisis teams, really showing, serious injuries of staff members just don't happen on these teams. So I think that's the biggest barrier that is really important for us to overcome. But I think, the city is on board. They understand that. It's just about sort of helping the public understand that as well. I think that's important.
And of course, now that this conversation is happening, people across the country watching to see how this goes. Really appreciate the time. Really appreciate the discussion. Asante, Rachel, thank you.
Thank you.